focus in this video is on tests that are administered to diagnose medical conditions. I want to relate the uncertainty surrounding the outcome of such tests to our discussion of probability. I'll start off with the uncontroversial idea that a good test is one that is unlikely to make errors. To formalize this, let's introduce two events. Let's use E to denote the event that a patient or test subject has a given medical condition. And let's use F to denote the event that the patient or test subject tests positive for said condition. One kind of error we'd like to avoid is one in which a patient tests positive when they do not have the condition. This event is called a type 1 error or a false positive. If we have a good diagnostic test, then we would anticipate that the probability of F given E complement would be small. In other words, we'd expect the type 1 error rate to be low. Another kind of error we'd like to avoid is one in which a patient tests negative when they actually do have the condition in question. This event is called a type 2 error or a false negative. Ideally, the probability of F complement given E is also small. In other words, an ideal test is one for which the type 2 error rate is low. Let's try to understand type 1 and type 2 errors with pictures. Let's represent the sample space of all possible test subjects with a rectangle. Some of these test subjects will have the medical condition of interest, and in keeping with the notation from a moment ago, we'll put them in the subset E. Those without the condition will be placed in E complement, that is to say, to the left of the vertical line. Let's now overlay on this the set of patients who test positive for the condition. Remember, we decided to call that set F. We think it would be good to have a low type 1 error rate. In other words, a small probability of F given E complement. In terms of the picture then, we can understand this conditional probability by thinking of the fraction of this area that is taken up by this shaded portion of F. That fraction is, of course, the probability of F intersect E complement divided by the probability of E complement. We also think it would be good to have a low type 2 error rate, in other words, a small probability of F complement given E. That probability can be thought of as this shaded area divided by the total area of E. What might be a bad situation? Well, here's one possibility. Here, we have a large probability of committing a type 1 error and a large probability of committing a type 2 error. Here's a situation that might be described as moderately poor. We have a large probability of committing a type 1 error, but a small probability of a type 2 error. The opposite situation is shown here. A small probability of type 1 error, which is desirable, but a large probability of type 2 error, which of course is not desirable. Connected to our discussion of errors are the ideas of the specificity and sensitivity of a given test. A specific test will tend to come back negative for those without the condition of interest. The specificity of a test can be measured as the probability of a negative test given that you don't have the condition of interest. In other words, the probability of F complement given E complement. Whatever way we express this probability, we want it to be high. If that's going to happen, though, we'll need a small probability of F given E complement, meaning we'll need a test that won't tend to generate a lot of type 1 errors. In other words, it won't generate a lot of false positives. Now, I'm not a medical doctor, but I'll suggest that a high white blood cell count might not be a specific test for, say, rheumatoid arthritis, since a high white blood cell count can occur for many other reasons. Moving on, a sensitive test will tend to come back positive for those with the condition of interest. The sensitivity of a test can be measured as the probability of a positive test given that you do have the condition of interest, or simply the probability of F given E. We would like this probability to be high, which means the probability of F complement given E should be low. Essentially, a sensitive test won't be prone to type 2 error. If many people with the condition of interest are missed by our test, then that test lacks sensitivity. Suppose for a moment that the condition of interest wasn't medical at all. Suppose the condition we wanted to test for is having met the learning outcomes of a math course. In this case, asking students to pass an extremely difficult examination would very likely be a test that lacks sensitivity. If the exam is too difficult, even those students who have achieved the learning outcomes will fail to test positive for the condition of interest. I'd like to now tackle an example. Let's consider diabetes. Individuals with this condition tend to show elevated blood sugar levels, and these levels are typically tested to obtain a diagnosis. When blood sugar levels are found to be above a particular threshold, the test for diabetes is considered to be positive. Suppose we've developed a new test for diabetes and have challenged it in a clinical trial against 1,000 patients or 1,000 test subjects. Let's say hypothetically that 750 of these test subjects had diabetes and the remainder did not. Let's also say hypothetically that 764 subjects tested positive, and of these only 632 actually had diabetes. Based on this information, how would we estimate the specificity and sensitivity of our new test? Before we answer that, let's take a quick detour to think about how we can use the numbers provided, and why using them in a particular way might be reasonable. The mathematical result that's possibly most relevant to this example is called the weak law of large numbers. Loosely speaking, this law tells us that the probability of some event E can be correctly estimated by simply repeating an experiment independently a large number of times, and then approximating the probability as the number of times E was observed over the number of repetitions carried out. In the context of our diabetes example, this suggests it's reasonable to estimate the probabilities connected to specificity and sensitivity respectively by expressing patient counts as fractions of the appropriately sized group. This is all rather intuitive, but it's nice to know there's actual justification for what we think ought to be true. Let's get back to our example and put the weak law of large numbers to work. I'll summarize the various counts with a picture. This rectangle represents the set of all 1,000 repetitions we conducted. In the course of our investigation, we observed the event E 750 times. That is to say, 750 test subjects had diabetes. Of course, 250 did not. We also observed the event F 764 times. That is to say, a positive test was returned in 764 of our repetitions. 632 of these positive results intersect with E, and 132 positive results do not. With the information conveniently summarized, we can now establish the specificity of the test by estimating the probability of F complement given E complement. We focus our attention over here, and we note that the count total in this stippled area is 250 minus 132. We divide this difference by the 250 patients found in the now highlighted bit of the rectangle to get a specificity of 0.472. Note that the specificity is 1 minus the type 1 error rate, calculated here. To get at the sensitivity, we estimate the probability of a true positive, or equivalently, the probability of F given E. That estimate is achieved by taking the 632 observations in here and dividing them by the 750 observations in E here. We see that the sensitivity in this case is about 0.843. This is also 1 minus the type 2 error rate, calculated here. It's time to recap what we've done. We defined two kinds of errors associated with tests for medical conditions. We also defined the specificity and sensitivity of tests and related these to the kinds of errors we might encounter. Finally, we saw an example of how to estimate the specificity and sensitivity of a test. In fact, we also saw how to estimate error rates along the way. You should now be well positioned to do at least three things. You should be able to explain type 1 and type 2 errors, specificity, and sensitivity. And you should be able to explain the relationships between them. You should be able to estimate the probability of errors, specificity, and sensitivity based on counts of test subjects. Finally, you should be able to explain how the weak law of large numbers justifies certain estimates of probability. Make sure you don't simply rely on videos like this as you work toward achieving the learning outcomes in this course. Keep up with the readings, try the quizzes, and clear up misunderstandings during tutorials. Spend quality time with the concepts, and I think you'll see your understanding flourish.